Unilateral balance. The participant stands on one foot and raises the medial longitudinal arch whilst maintaining balance. The participant is not allowed to use the wall for balance or support. The participant should keep the knee slightly flexed and over the toes throughout the exercise. This shows the wrong knee positioning. Closed chain resisted foot adduction. Participant is seated with the knees maintained at a forearm's length apart and flexed approximately 80 degrees. The feet are flat on the ground. The participant is asked to stabilise their leg by placing the contralateral forearm between the knees and reinforcing it with the ipsilateral hand. A green TheraBand is then looped around the distal and medial foot. The band is stretched laterally to full tension while maintaining a 45-degree angle of inclination with the floor. The band is attached to the wall with the goal of maintaining constant tension throughout the exercise. The participant starts from an abducted position and then slides their forefoot into adduction and slowly returns to the starting position. Each participant's individual foot range of motion in the transverse plane is marked on the floor, and that range will be achieved with each repetition of the exercise. The foot must remain flat on the floor during the entire exercise. Closed chain unilateral supination. The participant stands on one foot with the knee slightly flexed on a step with the medial side of the foot over the edge of the step. The other leg is hanging in the air. The participant lowers the medial longitudinal arch as low as possible and raises it again slowly. When conducting the exercise, only the foot should move and not the whole leg. The participant should focus on keeping the knee over the toes during the exercise. Fingertips can touch the wall to provide balance but not support. Bilateral heel raise with ball. The participant is in a standing position with a ball between the medial malleoli. They slowly lift the heels off the ground and transfer weight onto toes and then slowly lower again. When performing the heel raise, the participant must squeeze the ball between the malleoli. The knees remain extended throughout the exercise and the participant can place fingertips on the wall for balance but not support. Navicular drop measurement. The participants will be placed in a sitting position with their feet flat on a firm surface and with the knees flexed to 90 degrees and ankle joints in neutral position. The most prominent point of the navicular tubercle will be identified and marked with a pen. Subtalar neutral position will be established when talar depressions are equal on both the medial and lateral side of the ankle. Then, an index card will be placed on the inner aspect of the hind foot, with the card placed from the floor in a vertical position passing the navicular bone. The level of the most prominent point of the navicular tubercle will be marked on the card. The individual will then be asked to stand without changing the position of the feet and to distribute equal weight on both feet. In the standing position, the most prominent point of the navicular tubercle relative to the floor will again be identified and marked on the card. Finally, the difference between the original height of the navicular tubercle in sitting position and weight-bearing positions will be assessed with a tape measure, rendering the navicular drop amount in millimetres. The navicular drop will be calculated for both feet.